Hi, my name is Trevor Thompson. I manage benefit programs for the professional staff at Cleveland Clinic. One of my primary responsibilities is to ensure our staff members understand how our benefit plans work and how to make the most of their benefit plans once they've become enrolled. I'd like to take a few minutes to discuss some basics on navigating through health, dental, and vision plans, as well as flexible spending and health savings accounts. It's important to know how to choose the right plans for you and your family to ensure you're adequately covered and to understand the out-of-pocket costs associated with the coverage in the plans that you elect. I'll start my conversation with health insurance plans. There are several important considerations you should take into account when comparing health insurance plan options. What type of health insurance plan is offered? What types of services does it cover? What does it cost? And what providers can I use? So let's start with the question of what type of health insurance plan is offered. Health insurance plans generally take one of three forms: Preferred Provider Organization, or PPO, Health Maintenance Organization, HMO, High Deductible Health Plans, or HDHPs. Preferred Provider Organizations, or PPOs, use a set network of preferred providers. These plans may allow you to use non-network providers at a higher cost to you. PPOs generally do not require a primary care provider, or PCP, to direct your care, which allows you to have easier access to specialists and more freedom of choice with how and where your care is received. The cost associated with PPOs can vary widely depending on region, deductibles, and coinsurance amounts. An example of a PPO would be the Cleveland Clinic Employee Health Plan. The second type of health plan offering would be the Health Maintenance Organization, or an HMO, which would limit you to a select network of providers. All care is coordinated with a primary care physician within the network. If you want to see a specialist, you'll need an in-network referral from your PCP. Typically, HMOs have relatively low monthly premiums and low or no deductibles. However, your care is restricted to in-network HMO providers only. Services received outside of the network are not covered, with the exception of emergency care. An example of an HMO would be Kaiser Permanente. The last major type of health insurance plan would be a high deductible health plan, or an HDHP. These are generally tied to a broad network of providers. These plans have low premiums, but they have high deductibles. Typically, there is no coverage for any medical service until you've paid the annual deductible, which may even include primary care visits. High deductible health plans generally allow members to contribute to a health savings account, or HSA, on a pre-tax basis to help pay for out-of-pocket medical expenses, including the deductible. HSAs can be both employer and employee funded, and the balances can carry over from year to year. High deductible health plans are not ideal for aging members or members with existing health conditions, as the out-of-pocket costs associated with any care can become extremely burdensome. It is strongly advisable to contribute to an HSA if you enroll in a high deductible health plan to help offset future healthcare expenses for you and your family members. I'd now like to shift my attention to the types of services that are covered. Preventive care has become a major focus for most health insurance providers in recent years, so it should come as no surprise that most routine care is generally covered in full or with very low out-of-pocket cost. Emergency care is also generally covered at a higher percentage, both in-network and while traveling outside of the network. Beyond preventive and emergency care, it's important to focus on the types of medical care that you will most likely utilize based on you or your family's needs. For example, younger individuals may be more interested in maternity care or pediatric care as they begin families of their own, while older individuals may be more interested in managed care or prescription drug benefits. It's also important to review coverage exclusions to ensure you don't enroll in a plan that won't cover a service for which you may currently have a need. You can find all the information you would need with regards to health plan coverage in the health plan summary plan description or the summary of benefit coverage. It's okay to ask a prospective employer to review these documents before accepting an offer of employment. You will also want to consider the cost of the plan. While the premiums are the fastest and easiest way to compare health plan options, you will also want to focus your attention on deductibles, co-pays, and coinsurance. A deductible is simply the amount that you would have to pay out of pocket before the health plan starts to pay any benefits towards services you or your family receives. Co-pays are flat amounts associated with a particular service, such as the $10 copay for a primary care visit. These are generally due at the time of the appointment. Finally, coinsurance is the amount that you are required to pay towards a particular service. For example, if your health plan covers a specialist office visit at 80%, then your coinsurance amount would be 20%. So, while a lower premium may be more attractive up front, it may also set you up for large out-of-pocket expenses in the long term, especially when you're enrolled in a high-deductible health plan. Finally, it's important to note the types of providers that you can go to for care. Are providers close to where you live? Are the right kinds of providers easily accessible, such as pediatricians or other specialists? Can you go out of network, or are you restricted to a select group of in-network providers? It's important to feel comfortable with the network of providers you use to avoid coverage issues with the health plan that you decide to enroll in. I'll now shift my focus to dental plans. Most dental plans follow a PPO style of network, although HMOs are not uncommon. You'll want to make sure you use in-network dental providers to ensure you maximize your benefits each year. Generally, preventive care will be covered in full, while fillings, extractions, and other restorative services are partially covered. Orthodontic treatment may or may not be included in your dental plan. If there is orthodontic coverage, you'll want to check to see if there is an age restriction and what the lifetime maximum benefit is. Oftentimes, adult orthodontia is not covered by basic dental plan offerings. One last tidbit to remember is that children generally won't need to have dental coverage until the year in which they turn 3, as they typically won't require dental care as infants. Next, I'll talk about vision plans. Vision plans generally offer discounts on eyewear needs such as glasses and contacts. Discounts on refractive procedures such as LASIK may also be a covered benefit. Many vision plans also cover routine eye exams, often with a small copay per visit. When reviewing your vision plan options, you'll want to see if an eye exam is included. If not, it may be covered by your health plan. Flexible spending accounts, or FSAs, allow you to set aside pre-tax dollars to pay for out-of-pocket medical expenses and dependent care expenses for you and your family members. There are 2 types of flexible spending accounts available. The first is a healthcare FSA. This allows you to set aside an indexed amount per calendar year on a pre-tax basis to pay for things like deductibles, co-pays, dental procedures, eyewear needs, and prescription medications. Really anything that's medically necessary that you or one of your family members would require. The second type is a dependent care FSA. This allows you to set aside an indexed amount per calendar year on a pre-tax basis to pay for things like licensed daycare centers, preschool, after-school care, or nanny services for dependent children under the age of 13, or for a spouse or dependent who is unable to care for themselves due to illness or disability. The most important thing to remember about FSAs is that the balance cannot be carried over from year to year. So if you don't use it, you lose it. You also can't change your election mid-year unless you experience a qualifying life event, such as marriage or birth of a child. As such, FSAs should typically be used for predictable expenses only. Employers can offer a grace period through March 15th of each year to spend remaining balances from each FSA to avoid forfeiture, or they may allow up to a $500 carryover from one year to the next. You'll definitely want to ask your employer which carryover provision they'll offer to help ensure you don't lose out on unused dollars each year. It's also important to remember that you must re-enroll in the FSAs each year during open enrollment. Otherwise, your elections will not carry over from year to year. As I had mentioned earlier, health savings accounts, or HSAs, are exclusively tied to high deductible health plans. These allow you to contribute an indexed amount per calendar year on a pre-tax basis to pay for out-of-pocket medical expenses for you and your family members. This can be funded through both employer and employee contributions and are designed to help pay down the deductible and coinsurance on a pre-tax basis. If you end up enrolling in a high deductible health plan, it is strongly advised that you contribute towards the associated HSA, as there will come a time when you will have a large deductible to satisfy before the health plan begins to pay a portion of the cost for your medical services. You'll want to check to see if your employer contributes to the HSA as well, so that you can plan your own contributions accordingly. Again, the biggest difference between an HSA and an FSA is that you're allowed to carry over unused balances from year to year with an HSA. If you were to leave your employer and you still have a balance left over in your HSA, you can continue to spend down the balance on out-of-pocket medical expenses for you and your family members. You just won't be able to contribute to it anymore. In closing, it's important to remember that health and welfare benefits are a major component of your total compensation package, regardless of where you end up working. Reviewing things like plan design, cost, covered services, and network providers are crucial to making informed decisions prior to choosing the plan that will best meet your family's needs. Summary plan descriptions are the most comprehensive source of coverage information for each plan and should be reviewed carefully, especially if there are multiple plan options available. Finding ways to offset out-of-pocket medical and dependent care expenses on a pre-tax basis can also be important to ensuring you're making the most out of your health and welfare benefits on an annual basis. I hope what I've talked about today has been informative for you and that it helps make your decision process easier when looking at multiple health plans with your next employer.